Today on COVID-19 Local Impact, Trent University steps up to house frontline healthcare workers. Kawartha Lakes Mayor Andy Letham addresses the deaths at Crest Nursing Home in Bobcaygeon.
This past weekend, there was a large increase in the number of deaths reported at Crest Nursing Home.
And a jump in confirmed cases of COVID-19 in Peterborough County.
We've doubled our confirmed cases. We are now at 28 cases total, which is an increase of 15.
Welcome to COVID-19 Local Impact. I'm Dan Malta from the Your TV Peterborough studios. 15 new cases of COVID-19 were announced today from the Peterborough Public Health Unit. We'll now head to today's address from Dr. Rosanna Salvatierra as she goes into more detail.
So we certainly have had a lot of activity over the weekend, and essentially we've doubled our confirmed cases. We are now at 28 cases total, which is an increase of 15 new cases since we last reported on Friday. Of those 28 cases, 4 are still under investigation to determine whether there is a travel history or any contact with a case. One of those was just reported this morning, so we're still working on it. Of the 28, I'm happy to say that 3 of those are resolved. As far as the condition of the cases, 4 of our cases are in hospital and all others remain in self-isolation. We have, today we've got 9 people booked already to come in today. We had 10 that we tested here yesterday, and that brings a total of people in Peterborough tested to 673. And of those 673 people who've been tested, I'm happy to say that 422 have been confirmed to be negative. And we still are waiting for an additional 224 test results to be reported. As far as our outbreaks are concerned, we remain with the one long-term care home COVID-19 outbreak. None of the cases that are symptomatic are in hospital. They are all being isolated in situ, and the outbreak certainly appears to be under control. If you have questions regarding the Crest long-term care home outbreak, I'm going to suggest that you refer those to Haliburton Kawartha Pine Ridge, as they are the lead public health agency on that particular outbreak. As far as our testing swabs, we have 350 swabs on hand, so I think we're good to go for the coming week. And there were a few additional public health measures that were brought into effect over the weekend. So the province is now prohibiting any public gatherings of more than 5 people, unless it's a family group. Although we're still awaiting for details on how the federal quarantine will be enforced, we were glad to receive new guidance from PHAC, which is the Public Health Agency of Canada, on how to isolate whether someone is a returning traveler or not, and we will make that guidance available on our website. I think it's also the PHAC guidance, because it also includes good advice for people who haven't traveled, is a good reminder for us that we all need to be physically distancing ourselves at this time. So we all can still contribute to preventing the spread of this virus to others. The Ministry of Health is changing its how COVID-19 cases are being reported to provide a more relevant summary of the data from Public Health Ontario, and that will have expanded information, and it will be available each day at 10:30 a.m. We will start reporting our new cases every day, so that'll be a 7-day-a-week function going forward. And over the weekend, we had a minister's order to all healthcare providers to begin to report daily their protective equipment inventory, so that the province can better quantify the needs for PPE and also prioritize who has a critical shortage that needs attention. So those were all the sort of developments over the last couple of days, but I just want to end my comments with just one final note, and that is that it's on the importance of supporting our healthcare workers. I certainly have heard about some neighborhoods where at 7 p.m. at night, people are going out on their porches and banging their pots as a sign of support, which is very welcomed. But I also have heard anecdotally that some healthcare workers are not being allowed into some stores in the community because of where they work. I think this is a good opportunity to remind the community that healthcare and hospital workers are working very hard during this pandemic, and because of their education and their training and the work that they do, they know better than anyone how viruses are spread, and they also know how to correctly use hand washing and personal protective equipment to prevent the spread. So they also need to shop for their families during their time off, and I think it's very important that no one try to prevent them from shopping or treating them in a negative way because they work in a healthcare setting. So just a reminder that we all try and be safe, and that we be calm, and that we're kind to one another.
We'll continue to bring you the press briefings from Dr. Rosanna Salvatierra Monday through Friday on COVID-19 local impact. Now at Trent University, they'll be housing frontline healthcare workers at Zosky College starting on March 31st. Due to the university moving to online instruction and exams for the remainder of the term, Trent made 100 rooms available to healthcare workers. Each person will have their own room and private bathroom. The move allows hospital staff to temporarily self-isolate while continuing to care for patients. The 140 students who are still on campus have been moved to the Water Street residences on the west side of campus. The residence will be vacated and fully sanitized before students arrive in the fall. The Crest nursing home in Bobcaygeon is believed to be the most severe outbreak of COVID-19 in Ontario to date. On March 21st, an email was sent to families after 3 residents tested positive for the novel coronavirus. The situation has escalated, and as of Friday night, 34 workers were showing symptoms, 17 testing positive, with 4 negative, and the rest still awaiting results. The home is being ravaged by the virus as every wing is infected, meaning the sick patients aren't able to be separated from the healthy ones. As of this morning, 9 residents have died, and it's still unclear how many more are infected. The facility is in urgent need of more staff as more and more of the support workers fall sick. Now, we actually asked Dr. Rosanna Salvatierra about exactly that. Does she expect this to happen in Peterborough? Here's what she had to say earlier today from her press briefing.
I wouldn't be surprised that we will have a similar experience given our population, given the fact that we do have long-term care homes and retirement homes, that we do have a lot of frail elderly in these residences. That said, we're doing everything that we are capable of to prevent it, and so we're working hard to keep those people protected given the risks from this pandemic.
As COVID-19 local impact continues on your TV, we'll hear from Kawartha Lakes Mayor Andy Letham and Senior Homes. They're asking the public to be virtual pen pals. Welcome back to COVID-19 Local Impact. I'm Dan Malta in the Your TV Peterborough studios. Kawartha Lakes Mayor Andy Letham says the deaths at Pine Ridge Nursing Home are devastating, and today the government is forecasting another record single-day rise.
Good afternoon. Today is March 30th. As the COVID-19 crisis continues to unfold, our sole focus remains on stopping the spread, supporting our frontline workers, and maintaining our critical services. This past weekend, there was a large increase in the number of deaths reported at Crest Nursing Home. The news is devastating and continues to display the gravity of the situation we are all going through. All levels of government are working toward fighting this virus by implementing policies and enforcements wherever possible. Our municipality is dedicated to putting community safety first, so I want to reiterate what's currently in place to keep everyone safe. All municipal buildings are closed. Only vital services are continuing. All park amenities are closed, including playgrounds. All businesses who provide non-essential services are closed. For those businesses who need to remain open, please take precautions to keep yourself, your staff, and customers safe. A lot of stores have done a great job enforcing safety measures, such as limiting how many customers can enter at one time, creating social distancing inside the store, or having plexiglass in place to protect face-to-face contact. The province has just announced today we're experiencing yet another record single-day jump in confirmed cases across Ontario. The most important thing you can do is stay home. Remember, you're not just staying home, you're staying safe. You're not just social distancing, you're protecting others. And you're not just isolating, you're saving lives. Thank you.
Thank you, Mayor Letham, for the update. Our own Chris Potter speaks with Suzanne Hart, a mindset mastery mentor, about strategies for personal crisis management.
The simple fact that you're watching me today speaks to how much my world has changed. I started a podcast last year about mental health and my own mental health issues. And now here we are, very much in need of talking about all of our mental health during this crisis that's changing the world around us. First and foremost, we acknowledge those of you who are ill or those of you who have already lost someone. There is significant fear, anxiety, and grief that needs to be addressed, and we'll try and help through these segments. This is a crisis. There is no doubt this is a serious global crisis. Our leadership has told us exactly what we need to do, and for the most part, we are doing that. But where does that leave us? Our natural external landscape has changed dramatically. I spoke today with Suzanne Hart about what crisis might look like for you and what kind of strategies might help. She has 18 years experience as a crisis counselor, and now she's a personal coach helping people with their health and wellness.
That's a great question, Chris. And what's interesting about is crisis is different for everyone. And part of it is determined by what are the stressors that are already going on in my life? Because we all have our threshold. And so what we're seeing is for people, that threshold, it's almost like we're building. And what puts us into crisis is when a situation feels unpredictable, when a situation feels like we don't have control over it, because we are creatures of comfort. We are creatures of habit. And when our environment seems to be coming out of control, which is exactly what's happening, we've got this virus, this thing, this entity in the air that no one can see, and you don't know, you can't touch it. So people are feeling like their natural environment is very much out of control. And so what you see is the stress building because I can't do anything. I feel out of control. I feel like I can't impact this environment. And when we feel out of control, stress is a response to feeling out of control. That's all it is. Right? When I am stressed, it's because something's happening around me in my environment, whether it be traffic, whether it be a work environment, whether it be what we're seeing now, and I'm feeling like I can't control that environment, therefore stress begins to rise. And so what we're looking for is, how do I regain control? How do I regain control? And our tendency is to attempt to control what's out there.
Right.
Right.
And that leads right into hoarding and panic shopping and all of the things that we're seeing on the news, and people really, really not handling themselves very well out in public.
Right. So everybody knows about the toilet paper situation where there's been fights and different things over a simple thing that we naturally not fight over. But because people are not sure what's going to happen, they are trying to control what they can. So I got to have enough toilet paper. I've got to have enough food. I've got to have enough of all these different things. And they're bringing it home, and it's giving them a feeling of I can control something.
Right.
Right. And so as human beings, our desire is to believe that we have control over the things that are that should be predictable. And when they're not, we're turned upside down and our stress rises.
Right.
And so the question then becomes, what do you do? There's people who love music. There's people who love art. There's people who love to paint. There's things that we haven't had the opportunity to do because we have been, ripping and running and producing. And suddenly we're still. I was talking to someone and she said, I'm redecorating my home. I've wanted to do it for so long and I haven't had time. So she's moving around furniture and doing all sorts of different things. I know another person who's writing because they haven't had time to write and they've wanted to write a book. Why not? You got time.
Thanks for taking the time with us today, Suzanne. And if you'd like to watch the full extended interview, you can find it on my podcast Facebook page at facebook.com/We're Talking. In these trying times, we need to be sure to stay grounded and focused on staying healthy and safe. At the same time, we need to be sure that we are touching base with those friends and family that may need to just hear your voice today. Reach out. As Bill and Ted said, be excellent to each other. For Your TV, I'm Chris Potter.
Thank you very much for that, Chris. Now, last week we spoke with a local realtor, Catherine Hanrahan. She suggested speaking with a mortgage broker about what the 6 big banks have put forth, the option to defer your mortgage. So we did exactly that. Joel Scott, a mortgage agent with Dominion Lending Center, and he talks about the financial implications you may face if you choose to defer your mortgage.
I think one of the things people have to be aware of, and this is funny because this question came up way more than I thought it would. The first thing to clarify with the deferrals and that kind of thing, with any mortgage relief, the government is not going to take over and pay your mortgage payments. I don't know where that misperception came from or misconception came from, but it seemed to be one of the number one things that we got was, well, when's the government going to take over my payments? That's not what's happening. So the big 6 banks came forward and said, we're going to start a deferral program, offer people some relief who have lost their income short term. You've been laid off, whatever the case may be. If there's any kind of hardship, we're going to work with our customers to try and see if we can provide some relief. The initial broad strokes of that had people thinking, okay, great, I got no mortgage payments for 6 months. We'll just kind of pick it up as we go. One of the things you have to remember is that when you defer the payments and move your payments, however the bank's going to structure it or your lender, because to be honest, there is no blanket statement. Some of them are structuring it in different ways than others. The interest clock keeps ticking. So what's going to happen is that, say you have to skip 4 to 6 months worth of payments, and let's say on the average $400,000 mortgage, maybe you're paying $450 a month in interest payments. Well, over that 6 months, that $450 is going to keep amortizing. And what'll happen is that depending on your lender, they'll either work it in on the back end, they'll re-amortize the loan, and you may see an increase in the loan working up. The best idea is to call your lender, but please know there's no relief from that. Like when the interests are being deferred, that's exactly what's happening. They're being deferred. It's not a forgiveness. And depending on your situation, there may or may not be an advantage to doing a deferral. If you can stick it out and get through, you may save yourself thousands of dollars in the long term, because long term it is going to cost you. And what's going to happen is that as those deferral payments get pushed back, well, now you're paying interest on top of interest, essentially. Does that make sense?
Yep, that makes complete and utter sense.
And I think the other thing the lenders were talking about too, especially the big banks, the volume that they're seeing right now from people is overwhelming. One of our top lender partners, I spoke to our business development manager the other day, they had 1,000 voicemails by 10 a.m. So if you are not in a situation where you require a deferral, if you're not in an emergency situation, the lender partners and the banks are asking you, please hold off on calling because you're taking up a line for someone that needs it.
In times of crisis, many people turn to their faith or their church for guidance. But with all churches now closed due to COVID-19, many individuals are feeling lost with nowhere to turn. Executive Director of Youth Unlimited, Tony Posmus, passes along a few suggestions for people who find themselves in this situation.
A lot of people tend to kind of lean into spiritual things during times of crisis and uncertainty. And with the current state of the world and our society as a whole, that becomes really challenging. And so there's a few things that I would say to people in those situations. Is first, even though the building is closed, church isn't closed. And that's a really important message. Sometimes we tend to equate church with a building, because it says a sign, it says, Coburg Alliance Church, or, Church on the Hill, or, St. Andrew's Presbyterian Church. And so we think that that is where church happens. And the reality is church is everywhere. Church is not the building, church is the people that belong and are part of that. And so I've talked with lots of pastors the last couple of weeks. As we've all been navigating, how do we do what we're doing in this new situation? And a lot of it has moved online. And so even participating in a worship service that you would kind of quote unquote, traditionally do on a Sunday morning, you can still access those every Sunday morning. Lots of local churches, both in Coburg area, Northumberland County, and Peterborough as well, have transitioned all of their services from an in-person experience to or a gathering to an online experience. And so I would just encourage people to, if you're used to a church that you connect with on a regular basis, go to that church's website and find out what they're doing on a Sunday morning. I would say that most of them are either going to have some kind of a link to an online experience or a recommendation to some other church that's doing online services. And the second thing I would say is continue to reach out. Lots of, again, not just because there's not a physical door that you can walk into. Every church is still active and operating. And I was doing a Zoom call, as we're all doing even right now, with a bunch of pastors this past week, talking about what their operation looks like. And a lot of them are either monitoring their phone messages on a regular basis or even forwarding their main phone line to a cell phone. And so please don't, hesitate to call and try and get assistance and help, because that help is still available. It's just going to look and act differently. They may not be able to do in-house visits, but certainly lots of phone call chats and that kind of stuff can still happen. And if you're on technology, they can do Zoom calls and FaceTime, Facebook, all that kind of thing. So those things are still happening. They just look and feel different.
Peterborough City Council will be back in session tonight, and on Friday we were joined by Peterborough Mayor Diane Therrien. She went into the details about how councillors will proceed with the meeting virtually.
Because municipalities are governed by provincial legislation, we weren't previously able to pass any business via teleconference or video conference. And so last week, Minister Steve Clark, the Minister of Municipal Affairs and Housing, they were able to get through a bill that permits councils to have virtual meetings and have quorum count that way. So we've been using software, Microsoft Teams software here at the city in order to have updates, and that's the technology that we're going to be using on Monday for Monday's meeting. So how it's going to work is we canceled our meeting that would have been held this past Monday. So this upcoming Monday, we're going to be dealing with all the business that was on that agenda, plus some additional other business. As I mentioned, likely we'll be having a conversation about property taxes and what that can look like. So I myself will be physically in council chambers with a few select staff from IT in the clerk's office, just to make sure that we're able to facilitate. The other 10 councillors will be calling in. We do have some registered delegations who we're gonna have a bit of a special general committee meeting at 5:45 to change our bylaws to allow our virtual meetings and to allow virtual delegations. So it's going to be a learning experience on Monday, and we ask people to bear with us. But it should, we've had a few kind of test runs and some training on it, so it should hopefully work well.
We'll have an update for you on what happens at Peterborough City Council on tomorrow's show. Physical and social distancing are perhaps affecting nobody more than the elderly in long-term care facilities, and senior homes are asking the public to be virtual pen pals. Looking for something to do while social distancing? You can be a virtual pen pal with Centennial Place residents. Help put a smile on residents' faces and lift their spirits during this difficult time away from family and friends. If you or someone you know would like to bring some joy to the residents of Centennial Place long-term care, then send your letters to the email address on screen with pen pal as the subject. We encourage all of you to take part in the Centennial Place Virtual Pen Pal program. Your home right now is solitude with options. Local photographer Julie Gagne took photos of people taking advantage of those options. She presents Within, portraits of people experiencing the great indoors. We'll leave you with this and see you tomorrow.
it's hard.